Hi, I'm Anthony Gosh, a consultant spinal neurosurgeon and founder of the Spine MDT, and today I'm going to talk about spinal alignment and whether it actually matters in terms of neck pain and back pain. So the reason I'm doing this video is that I often see patients with back pain or neck pain who have had numerous treatments by either a chiropractor or a practitioner privately, and it's failed to treat them, and they've come to me with a clinic letter with some pictures on it of x-rays they've had done with these stupid lines drawn through them. So, for example, what a normal spine should look like with a green line here, and what their spine looks like with this red line here. This is the lumbar spine, the lower back, and this is the neck. And therefore it was assumed by their practitioner that this must be the cause of their back pain or neck pain, and then they undergo multiple treatments called either adjustments or manual therapy depending on the practitioner, and guess what, a month later they're still in pain. So this brings me back to an earlier video, an interview I did with Peter O'Sullivan, a world-renowned physiotherapist who's published hundreds of papers on back pain and who's completely debunked the myth about posture. Alignment of the spine and posture are two related things, but the relationship with that and back pain actually is a bit of a myth. Now, this isn't just a criticism of chiropractors, but also surgeons. So to clarify, on this diagram here, so for those listening on the podcast, the normal human spine from a side view has a kind of lazy S shape. And then quite often we do see a slightly flatter spine, especially in the lower back, that we call flat back posture or flat back syndrome even. Um, and there's always been controversy around whether that's the cause of back pain or whether that's a posture we adopt when we have back pain as a result of back pain itself. But often it's shown to just occur with aging. It just does get a bit flatter. It's never been a clear-cut correlation, and I have seen surgeons try and correct this with instrumentation to recreate the natural curvature. And in many circumstances, that just doesn't work, and it causes more pain and makes things worse. So that brings us to a really interesting study that was published in the European Journal of Spine, which looked at two groups of patients, one group with back pain and one group without. And in both groups, they were subdivided into a sort of younger population and an elderly population. And they looked at the alignment of the spines in the two groups. So if I bring you to this diagram here, the only finding where there may have been some correlation with spinal alignment and back pain is if we look at the frontal view of the spine, so looking at someone's spine head on. For those listening on the podcast, so at the base of your neck, there's a notch that you can feel, a great big knuckle of bone, and then down in your lower back, at the bottom of your spine, where the spine meets the pelvis, there are two dimples either side that kind of mark the sacroiliac joints. And just think of a point halfway between that dimple. So in the normal spinal alignment, if we're looking at someone head on, if you were to hang a plumb bob from that knuckle at the base of the neck all the way down, it should run to a halfway point between those two dimples. So if there's what we call truncal imbalance, that line gets shifted to one side. And it found that whether you're young in a younger population group or an older population group, there was a correlation between this finding, that misalignment, and back pain. However, if we look at a more side view of the spine, with the flatter back, for example, there's in the past there have been publications showing a possible correlation, but what this study did, it did actually compare age groups, and it found that it was just more common. It was just a more common finding in the slightly older population. And previous studies have probably shown that because back pain is probably seen more commonly in a slightly older population. Therefore, it's hard to say that having a flatter back is an independent factor that's associated with back pain. So, look, of course, in the extremes of this situation, which were excluded in this study, where you've got a very kyphotic spine, so on the side view of your spine, it's very bent forward, which could either occur from, say, a fracture or of instability. That's a different case altogether. And the same goes with scoliosis. So, when I was talking about hanging that plumb bob line between the base of the neck and drawing the line straight down to the base of the spine at the frontal view, if it's so shifted as a result of scoliosis, that's another group of patients as well. And often a scoliosis surgeon, I've done another video on this, may advise surgery depending on the Cobb angle and other factors. So the point I'm making is that if you have a side view of your spine and the alignment is a bit off, a bit flatter, or not quite aligned with the textbook alignment of the spine, that's usually a coincidental finding and not really related to your back pain. Now, another big name in managing back pain is Stuart McGill, who I've interviewed, and he's quite explicit in that in his practice there is no such thing as non-specific back pain, there is always a cause. So I prefer the term non-pathological back pain, where there isn't anything seriously structurally wrong with the spine that can cause instability or put the nerves or the spinal cord at compromise. So there may be a subgroup of those patients, for example, that where we've identified an acute tear in a disc, not a herniation or a prolapse, where nerves are at risk, but just an acute tear that may be the source of the pain. And therefore, some of the more focused exercises, like the McGill Big Three exercises, may be helpful. But I'd say in the majority of patients where you can't really determine an exact finding on the scan that's a correlation with the back pain, that's where I prefer Peter O'Sullivan's approach with cognitive functional therapy. And that's because pain in the back is often multifactorial. The structure or the anatomy or the findings on a scan might be one small part of it, but there are multiple things going on in your spine. Muscles get strained. And one big factor that we've identified over the years is abnormal beliefs, such as the malalignment of your spine being the cause of it, as someone may have demonstrated on one of your x-rays. I've done a video on the catastrophic effect of MRI scans, and there's a study that has shown that the findings on your MRI scan, no one has a normal MRI scan, and often when people read the reports without having it explained to them, that finding itself is catastrophic, exacerbates the pain and makes things worse. I hope you found this video helpful. If so, please click like and subscribe. And also, if you've listened to this on the podcast, I'd be really grateful for a 5-star review on whatever platform you listen to it on. For more information, please visit us at spinemdt.com to see how we can help you.